Good evening, my dear doctors, my dear students. Today I am going to discuss within 10 minutes a very important flow chart. In your NMC curriculum, a separate competency is only for calcium metabolism. How calcium is regulated. Okay. And whatever I'm going to tell you, it is the gist of your calcium metabolism. I mean, you can write a full essay, you can write the physiological basis, you can solve MCQ if you understand these important points. So first of all, let me tell you, calcium metabolism is regulated by mainly three hormones, three organs. Okay. So three hormones are mainly, one is, the most important one is parathormone. Second is your active vitamin D, not vitamin D, active, I mean calcitriol. When I say calcitriol, it is the active form of vitamin D3, which is acting like a hormone. So vitamin D is a vitamin also and a hormone also. But which vitamin? It is calcitriol. So first is parathormone, second is calcitriol, and third is calcitonin. And three organ system are, one is your intestine, second is your kidney, and third is your liver. Okay, it can be intestine, kidney, or you can say bone because calcium is also from bone. So liver will conversion will happen, but if you talk about the main organ, then it will be bone. Okay, how it is acting on the bone. So vitamin D3, calcitonin, calcitriol. First of all, let me tell you about parathormone. The first hormone is parathormone. Parathormone increases calcium and decreases phosphate. Parathormone increases what? Calcium in the blood and decreases phosphate. It means the arrow is opposite. Whenever parathormone is acting, arrow will be opposite. Calcium will be increased and phosphate will be decreased. So if parathormone is high, calcium will be very high and phosphate will be very low. So in hyperparathyroidism, just see the arrow, both will be opposite. Calcium will be high, phosphate will be low. In hypoparathyroidism, okay, calcium will be very low and phosphate will be high. I mean, what you have to note there, it is the arrow. In the blood report, you have to check the arrow. One will be high, one will be low because parathormone is increasing calcium in the blood and decreasing phosphate in the blood. Coming to number two, vitamin D3, it is called as calcitriol. Calcitriol is the active form of vitamin D3. It not only increases the calcium, it also increases the phosphate. Listen very carefully. It not only increases the calcium but also phosphate. So if there is a hypervitaminosis of D3, calcium will be high and phosphate will be high. On other hand, if both are low, calcium and phosphate, in children, it will be rickets. In adults, it will be osteomalacia. So arrows are similar. So if in the exam they have given a clinical case and both are having the same arrow, I mean both are either increasing or decreasing. Okay, it is giving you a hint for vitamin D3, calcitriol. Third is your calcitonin. Calcitonin tone down the calcium. It means it decreases calcium in the blood. It is good for bone. Why? It prevents resorption of calcium from bone. So three hormones. One is parathormone, calcitriol, and third is calcitonin. Now, if I ask you, parathormone works on direct function is on the bone and kidney. Indirect function will be on the intestine. Okay, so if I talk about the bone, you all know that parathormone act on the bone to resolve the calcium from the bone. You know this. But if I ask you, parathormone has receptor on osteoblast or osteoclast. Many of you can say it is osteoclast because it is dissolving the bone. But mind it, it is osteoblast. From osteoblast, it will form rank ligand and then activate osteoclast. So of course, osteoclast is going to be activated, but via osteoblast. It is a rank ligand from osteoblast which is activating osteoclast to dissolve the bone and increases calcium in the blood. Now, rank ligand is good for bone or bad for bone? You will say it is bad hormone. It is a villain. It can cause osteoporosis. That is why there is a antagonist, physiological antagonist of rank ligand, and that is called as osteoprotegerin. It is called as osteoprotegerin. So osteoprotegerin and estrogen, they inhibits rank ligand and prevent osteoporosis. That is why after the menopause we have post-menopausal osteoporosis. That is why after the menopause there is always post-menopausal osteoporosis. I hope this function is clear. How parathormone is acting on the bone. This flowchart is clear in your mind. Now, second flowchart about the kidney. If I talk about one cell of the kidney, there are actually three steps of calcium absorption. First, calcium absorption from the lumen. Second, what happened in the cell. And third, how calcium is absorbed from the basolateral side to the blood. So on the luminal side, we have TRP V5 in the kidney and TRP V6 in the intestine. I hope you will not forget this. So on the luminal side of the kidney cell, we have TRP V5 to absorb the calcium. And this is dependent on para hormone. Calcium will be absorbed from the kidney via TRP V5, but it will depend on what? Parathormone. And then calcium will bind with cal binding. And the third step is that calcium will go from the basolateral side by a channel or pump, you can say, and that is called a sodium calcium exchanger. So try to build that image in your exam, because in the exam you will not have book, you will not have notes. So try to build image, and that is possible when we can talk like this. Keep your book aside, and now you will talk. If you talk like this, you can write in the exam. So what is happening when calcium is absorbed from the kidney? There are three steps: on the luminal side, in the cell, and basolateral side. On the luminal side, calcium is absorbed in the kidney by TRP V5. TRP V5 is the channel dependent on parathormone which help in calcium absorption. Second step is calcium will combine with cal binding. And the third step is on the basolateral side, calcium will be absorbed by sodium calcium exchanger. Clear? All the three steps are clear. So this is how parathormone is acting on the bone and on the kidney. Now about the intestine. Now you will be happy to know, okay, that the steps are common for kidney and intestine. You need not remember more steps. So in the intestine also, on the luminal side, you have TRP, but here you have V6, not V5. And second step is common. Calcium will bind with cal binding. And the third step is sodium calcium exchanger. But the main difference here is that all the three steps in the intestine depends only on calcitriol, active form of vitamin D3. No role of parathormone. No role of parathormone. So all the three steps in the intestine, TRP V6, cal binding with calcium, and sodium calcium exchanger, all these three steps are controlled by whom? Answer is only by active vitamin D3, that is calcitriol. On other hand, if I talk about the kidney, I told you TRP V5 depend on the parathormone as well as vitamin D3. Second step, third step depend on vitamin D3. So absorption or resorption of calcium in the kidney depends on both parathormone and vitamin D3. On other hand, calcium absorption from the intestine, all the three steps depend on what? Only vitamin D3, calcitriol. After this session, open your book, Gnom or Guyton or any book you are reading and see this. You will never forget this. Now, last thing I want to add here, and that is about vitamin D3, how it is formed. So, In our skin, we are having a pre-vitamin, a raw material that is called as 7-dehydrocholesterol. When ultraviolet B, which is available in the mid-noon, not in the early morning. A lot of students are saying early morning, no, mid-noon. Okay, will fall on the skin. This will be converted into cholecalciferol, and when it goes to the liver, it becomes 25 hydroxycholecalciferol, or called as calcidiol. In the kidney, in the PCT, in presence of parathormone, it is converted into 125 dihydroxycholecalciferol, called as calcitriol. Calcitriol. Now, this is it for today. I will not take much of your time because I have promised I will take only 10 minutes of your every Friday and Monday. But if you open the notes, okay, and you will see that we have covered more than 10 pages of your books. A lot of things are covered if you understand what I'm telling you. Immediately, if you open the book, you will not forget. So, hope to meet you next Monday. Till then, bye bye. All the best.